Hi, Dr. JP Pizzino again here, talking today about ketogenic diets and what they're good for. I get lots of questions about this, and there's a lot of confusion. There's all kinds of books and podcasts and new food products out there, so maybe you've even tried this before with or without success. The ketogenic diets have been promoted for many different conditions: weight loss, cancer treatment, diabetes control, reversing Alzheimer's disease, treating seizures, and even certain hormonal conditions. So they actually can do a lot of different things in the body. And there is actually good research evidence that supports all of these different conditions being treated. So let's just talk about them one by one to learn more about how to apply ketogenic diets. So in weight loss, this is actually changing your body from carb burning to fat burning. This is similar to changing an engine in a car from a gasoline to a diesel. So it's actually changing the fuel that your metabolism is using and not burning carbs and instead burning lots of fats. And this is actually useful in certain conditions because all of our cells, virtually all of them, have both ways of using fuel. They can burn carbs and they can burn fats, but some cells actually prefer one over the other. So in cancer, one of the mutations in cancer cells is that they have lost the ability to burn fats and they can only burn carbs. So if we drastically reduce the number of carbs, then that cancer cell is going to starve because it has to use fat burning. This also applies to many of the conditions in the brain. So the brain it relies heavily on both fat and carbs, but when we use carbs, that can create things like type 3 diabetes, which is what Alzheimer's disease is. It's actually called type 3 diabetes because it has to do with abnormal sugar usage in the brain. So when we change to fat burning, it can help restore nerve function. It's also been proven to treat certain types of seizure disorders. I definitely recommend that if that's what you're using it for, you be under a doctor's supervision for that. So there are certain people who should not try a keto diet. So let's just talk about that to begin with. If you're pregnant, a pregnant woman should not do this while they're pregnant. You can safely do it even if you're breastfeeding afterwards, but not during pregnancy. If you have a low body mass index, so you're thin, like a BMI less than 19, you really need to think about this no matter what condition you're doing it for. So for instance, let's say you're a type 1 diabetic on an insulin pump. That person really needs to work with a doctor before attempting a ketogenic diet. If you have familial high cholesterol, this runs in your family, you may need to be monitored during this. There is a small subset of people that are actually made worse by the ketogenic diet when we're talking about cholesterol, but there are many people who are made better. And so to figure out where you're falling in that, you need to be monitored by a physician. And for most conditions other than the seizure disorder, this is not intended to be a long-term lifestyle condition. So you aren't going to stay in ketosis all year round. It can be used intermittently, like with paleo or intermittent fasting or other nutrition approaches, so that you're not actually in ketosis continuously. That is an area of research to determine how long is it actually safe. Most information at this point tells us that about 3 months of doing it is probably pretty safe. So ketogenic diets are very different from most other diets that simply tell you eat this, not that, because we are actually creating a chemical change in your metabolism that can be measured. And you will need to measure this at home to get the most out of your ketogenic diet. So people who tell me that they've gone keto and they've never measured, we have no idea whether it actually worked or not, because it has to be measured for us to say, are we really in ketosis, which is the name of the state that is a fat-burning state. And so you can use urine dipsticks to measure this, which are obviously the easiest. They basically only work for the first few weeks, and then the body adapts, and so the urine isn't as good a way of looking at it. And then you have to choose either a blood monitor or a breath monitor. Obviously, we don't necessarily like having to prick the finger to get the blood, but at this point, that does seem to be the most accurate way to measure it. But you really only have to do it about once a week. It's not like diabetes where you have to do it multiple times a day. And I do tell people not to even measure in the first 2 weeks of going on a ketogenic diet, because it takes a little while for the body to switch over, and it can be discouraging if you think you're doing everything right and it's not showing up. So you have to just give your body some time for that new type of metabolism to kick in. There are some reasons I would strongly recommend that you work with a physician. This is one of the things that I do when I'm working with people to help make sure that you're getting the most from that ketogenic diet. So if you are on medications for things like diabetes, cholesterol, high blood pressure, seizures, or you have kidney or liver problems, you really need to consult a physician who's knowledgeable in ketogenic diets before attempting this. If you try it for a couple of weeks and you don't notice any weight loss with it, then this would need to be something we would want to look at. If you're already at an ideal body mass index that's 25 or less, and you're concerned about losing too much weight, we need to figure out how to not have you lose weight from the ketogenic diet. One of the things I recommend is to encourage you to become a free member at my website, which is selfempoweredhealing.net. You can just go to the front page and sign up for a membership, and that way you'll get advanced notice about our free workshops. I do blogs that have more information about things like the ketogenic diet and plant-based diets and so forth, and we provide other information free to you about helping you to change your metabolism. So don't forget to share this video with your friends and family, and please subscribe and click the bell.